Hey everyone, if you're a parent of a child on the autism spectrum, the world of therapies can feel, well, it can feel like a dizzying maze, right? Full of information, big promises, and a whole lot of hope. So, in this explainer, we're going to try and cut through all that noise together. We'll use real science and actual stories to help figure out what's promising and what's just hype.
This right here, this quote comes from a mother in a CDC case study. And wow, it just perfectly captures that urgency so many parents feel, doesn't it? When your child is struggling, your first instinct, your only instinct, is to act. You want to explore every single possible avenue for support. So, to really bring this whole journey to life, we're going to follow one family's story. It's about a young boy and his mom, and they're searching for real, actual solutions in what feels like a sea of overwhelming information.
All right, so let's meet Kofi. He's 8 years old, and for years he was making really great progress. But then suddenly, he started struggling with some really challenging stuff. Aggression, and some serious sleep issues. And his mother, well, she was feeling desperate. So she did what a lot of parents would do. She started looking for answers, and that search led her to explore what's known as complementary and alternative approaches.
And you know what? Kofi's story is not unique at all. When the conventional therapies, the behavioral and medical stuff, aren't providing all the answers you're looking for, it's completely understandable for families to start looking for other options. That search is a really common part of this journey.
So where does that search usually begin? Well, for a lot of parents, it actually starts right in the kitchen. Special diets. They're one of the most common, most widely talked about alternative approaches for autism.
And the most famous one, by far, is the GFCF diet. That's gluten-free/casein-free. Now, the idea behind it, the theory, is that some kids with autism might have something called a leaky gut. The thinking is, this could let little bits of protein from gluten and casein get into the bloodstream and mess with the brain. So if you follow that theory, the diet is simple. You remove all the foods that have those two proteins.
Okay, so the big question is, does it actually work? Well, to find out for real, scientists can't just rely on one single study. Instead, they do this really cool thing where they combine the results from a bunch of studies. It's called a meta-analysis, and it gives them the most reliable answer possible. And back in 2021, a major review did exactly that. They looked at all the best research out there on the GFCF diet. So, let's see what they found.
So here's the bottom line. That huge review, it found that the diet showed a small, but, a noticeable benefit for a couple of things, reducing those repetitive behaviors and for improving cognitive skills, like thinking and learning. But, and this is a big but, it found no major effect on social skills or on communication. So what's the conclusion? Well, it shows some promise for certain specific challenges, but it is definitely not a cure-all. We still need a lot more research to figure out who it might actually help the most.
All right, so from the kitchen, where do a lot of parents go next? The supplement aisle. And man, this is another one of those areas where you're just hit with a dizzying number of choices, and every single bottle seems to promise it's the answer.
Let's start with a supplement for a super common issue, the same one Kofi was struggling with: sleep. So the evidence for melatonin is actually pretty good. It can be effective in helping kids with autism fall asleep faster and stay asleep longer. Now, it's generally considered safe for short-term use, but the NIH is quick to point out that we just don't have that long-term safety data. And that, right there, makes having a conversation with your doctor absolutely essential before you even think about starting it.
Okay, what about omega-3s? The stuff you find in fish oil. We hear about them all the time for brain health, right? But when it comes to autism specifically, both the CDC and the NIH point out that the studies so far are, well, they're pretty mixed. The scientific jury is still out. We just don't know for sure if they offer a clear benefit.
And as you can see here, we start to see a pattern with so many of these other popular supplements. Take vitamin C. The potential benefit? It was based on a single study that was never repeated. Or look at vitamin B6 and magnesium. The research there is often pretty low quality, and get this, it can even carry a risk of toxicity at high doses. And probiotics? Super popular for gut health, sure, but for autism? There's just no meaningful research there yet. It's this recurring theme, right? A promising idea that just doesn't have the hard data to back it up yet.
Okay, we need to shift gears for a minute, because it is absolutely crucial that we talk about therapies that are not just lacking evidence. We're talking about things that can also be really expensive, totally ineffective, and in some cases, truly, truly dangerous.
First up is something called hyperbaric oxygen therapy, or HBOT. And this is one you'll see pop up a lot if you're searching online, promising to help with a whole range of conditions.
So the whole idea here is that by forcing more oxygen into the body under pressure, you can reduce brain inflammation. But what does the actual evidence say? Well, multiple, really rigorous studies, we're talking randomized controlled trials, the gold standard, they have found no benefit for kids with ASD compared to a placebo. None. And for that reason, it is flat out not a recommended treatment.
All right, next up is chelation therapy. This is another one that Kofi's mother, from that case study we talked about, read about online. And this one is based on a very specific and totally unproven theory.
Okay, so this therapy is based on the completely debunked idea that heavy metals cause autism. The process involves using chemical agents to literally strip metals from the blood. And the NIH is, well, they're unequivocal here. There's zero scientific evidence that this helps with autism symptoms. And what's even more important is that it can be incredibly dangerous because it can strip essential minerals right out of the body. The FDA warns very, very strongly against it.
And honestly, the list of unproven therapies just goes on and on. The NIH also specifically calls out things like secretin, which is a hormone, and a bunch of different antifungal agents. The bottom line for all of them is the same. The scientific evidence to support using them for autism just isn't there. Okay. Phew. So, we've looked at diets, we've looked at supplements, and we've talked about some really serious red flags. So with all this conflicting information flying around, how on earth can a parent navigate it all safely?
And this right here, this is probably the most important takeaway from our entire discussion today. The goal is not to chase after some single miracle cure. The real goal, the smarter goal, is to shift your focus. It's about developing a consistent, safe, and collaborative process for evaluating any potential therapy that you happen to come across.
So, what does that process actually look like in the real world? It looks like a partnership with your doctor. Seriously. Bring them the articles you find online, ask them the tough questions, is this really safe? What is the actual risks? What does the science really say? This is exactly what the pediatrician did with Kofi's mother. They became a team. They worked together to weigh all the options and make a smart, informed plan.
And that is the absolute key. This isn't about a doctor just dismissing a parent's concerns, and it's not about a parent feeling like they have to hide what they're trying. No way. It's about building a team with one shared goal, finding what's safe, what's actually supported by evidence, and what is genuinely going to be helpful for your child. So we're going to end by leaving you with a question, something to really think about. Before you start any new diet, any new supplement, or any new therapy, what is the single most important question you should ask? Not just your doctor, but yourself. Maybe it's something like, what are the potential harms here? Or maybe it's, how are we even going to measure if this is working? Defining that one core question, that is the first and honestly the most critical step toward making the best possible choice for your family.